to the explainer for why it's okay to respond, and it's from the Census Bureau, why you're allowed to respond without an ID. You can respond without an ID online. You can respond without an ID when you call them. And if you still have your paper form, as long as it's postmarked by September 30th and they receive it by October 7th, they'll count it. Okay, so please do respond. Next slide, please. This is just another NLC resource of ideas to get out the count. Next slide. Again, that's a link there. This is a list of historically undercounted communities, just to put them all in one place to give you an idea of who makes up the historically undercounted communities. So this is different characteristics, but frankly, about 40% of the country, every single census does not self-respond. 40% of our country basically is a historically undercounted community, right? That's a lot of folks, and they probably fall into multiple buckets. So there's a lot of people out there. There's still people that can self-respond, and it's really important to encourage that. In this yellow box, the CUNY hard to count map, I will show that in a second. Maybe if I can share my screen, I'll do it after I wrap up the rest of the stuff, just to give you a quick insight into what that is. Next slide, please. Okay, the next 15 slides are all ideas for get out the count. This one is from actually not far from you, probably in Florida, Franklin County. It's basically, they call it their product placement approach. Anytime they have anyone on their county, anyone in a position where there might be on a video, like everybody on our call, having a census pin, making sure that they drop census in there. You know, we've all seen a TV show or a movie where they pick up their Coke glass and just start drinking it, but you can see product placement, right? So think census for that. Next slide, please. Okay, keep going, keep going, keep going, keep going. You guys can look through all of these later if they're of interest. Keep going. So this is where just again, laundry list of different ideas. If you have, flyers that you can print out that talk about why it's important for your community to respond to the census. If you could do a radio interview, especially in languages other than English, or in in radio stations that target really specific areas where there might be a high rate of low response. There's car caravans where you actually have cars sort of drive through low response neighborhoods, shouting out hey, fill out your census. You can see Opelika did one. Okay, next slide. Next slide. For social media, you can put on your own social media. Hey, have you filled out your census? Go to www.my2020census.gov. Fill it out right now. You don't need your ID. Next slide, please. And then for contact lists, this is for any organizations or businesses that are out there. I heard, I think the president was mentioning that he owns an insurance business, but absolutely on the messages that you're sending out to your customers, if you own a storefront, put a poster in the window. NLC, it's in the slideshow, has a link where you can print out. We've created posters, flyers in 11 different languages. You can print that out. It's free. Take it. Do whatever you need to do with those and just get those in front of people. Next slide, please. Next slide. Okay, I think that wraps us up for this. Can I take 1 second to share my screen? Okay, so this is let me just close that. This is the hard to count map. If you just go to Google and you start to type census hard to count map, this will be the first result. You just click on it. So this is what it looks like when you see the whole country. And you can see that right now, the country is at about a 66% self-response rate. I pulled up Jacksonville, and you can see that when you start to drill down at the city level, you get a different picture, right? There are pockets that are at the 50 to 56% response rate. And I'm obviously not familiar with these areas, but I'm sure you all are. There's these pockets that are in the 40 to 50% response rate, right? And so those are the areas that really, any outreach that you're doing right now, you really want to think about targeting. This is a very easy to use map. That's why I kind of point people to this over the Census Bureau's official map. That's a little bit more complicated to work through. But if you just go Census hard to count map, you can find the neighborhoods and areas that are that have a low response right now. That's it. My contact information is also on that slide, so please feel free to get in touch if you have any questions.
Thank you very much. It was a great presentation, and I think most of us here in town know those areas, and those areas are areas that we serve that are the lowest, and we've been working hard to bring those numbers up. And by the way, I'll recognize Julia Henry Wilson, who has been leading our census work here at the Urban League and has done a fine job and working to bring information to that area. So thank you again, and we really appreciate your coming from so far away to be with us. And that brings us to President Rumlin from the Jacksonville Urban League.
Okay. NAACP.
Oh, did I say Urban League? Well, you know, maybe we could have an additional president, huh?
Hey.
No, we gotta have two at the same time. Got to get rid of one already.
Yeah, President of the NAACP. Thank you for being here.
Okay, thank you, Dennis. I certainly won't be as lengthy as the COVID and the census, but all of us know the importance of the census. So really appreciate that presentation. But I want to just talk briefly about the upcoming election. And I think all of us have to take this election serious. Perhaps this is the most important election season since 1960 between President Kennedy and Nixon. And the reason why that election was so important that it led up to the passing of the Civil Rights Bill of 1965, although President Kennedy was assassinated. But the country was headed in the right direction. And the direction we see us going in now is just reverse. So the soul of our democracy somewhat is at stake in this upcoming election. And if we don't get out and vote, this country will be forever changed for the next 30 to 50 years. We see what's happening with the Supreme Court as a result of the death of Justice Ginsburg. We see what Congress is attempting to do by way of the current president. So we see our democracy slowly changing if we do not get out and vote in this election. And what we're attempting to do is, if you can contact 5 people, have those folks to contact 5 folks, have those folks to contact 5 folks. We got to get these people to the poll and get, for them to cast their ballots. Now, there's several important dates over the next few weeks. And one of them is the voter registration deadline, which is October 5th. Vote by mail, you can request a ballot. Deadline is October 24th. Early voting will begin on October 19th through November 7th. And as a result of this being a presidential election, the polls will be open 12 hours this year from 7 to 7. So we really don't have no excuse to get out and vote, but we have to plan our vote. And we have to plan on how we're going to vote. If we're going to do it by mail, then once we get our ballot, we need to get that ballot back into the mail immediately, because we see what's happening with the post office. So we're going to have some serious issues and some serious problems in this upcoming election. So we need to educate our folks, educate this community as it relates to the importance of this particular election. Also on the ballot are going to be 6 amendments that you need to review and study. In particular, one of them is the half-cent sales tax. This particular referendum should have been passed last year in August, but due to the climate in our city, it didn't happen. But as a result of what happened with JEA, some of our political leaders changed their mind of thinking and went ahead and did the right thing in supporting the half-cent sales tax for the Duval County Public Schools system. Homestead referendum is on the ballot. And Amendment 1 is dealing with persons who's 18 years old, and from talking with some of the local legislators, this might be somewhat of a redundant amendment. Amendment 3 is one that I think we need to be paying close attention to, and perhaps that should be a no vote. That amendment deals with election, wherein if you're not a member, if you're not a registered voter, as it relates to a party voter, Democrat or Republican, at this particular time, you can't vote in an open election. But this amendment will change that, wherein non-party affiliate person who holds that designation will be able to vote in these open elections. So we need to pay close attention as it relates to whether money is going to support this amendment, because we think that it will dilute minority elected officials in this state and in this city. So we need to be mindful of the fact that this is the most important election perhaps since 1960.
Well, thank you very much. Appreciate your comments. They definitely need to be heard and spread from here out to the community. So thank you again, President Rumlin.
Sure.
That brings us to Dante Jennings, President of the Jacksonville Urban League Young Professionals.
Good evening. Once again, such an honor to go after President Rumlin, and timely. So just really following that, there is no greater threat to our democracy in recent years than what we've seen through voter suppression initiatives and strategies. So I really just want to speak on voter suppression, what that is, and what it looks like in context, especially for the young professionals, because it's going to be important for us to get out and really galvanize during this election. So combating voter suppression doesn't have a one-size-fits-all method. So it's going to require us to stay close, one, to the people and to the power that plays it. You know, in Florida, we are a swing state. So oftentimes that means that we have to have a certain level of activism and urgency. And I think earlier we spoke on that. I don't think they're using a word that will capture how important and intense that this election cycle will be due to the magnitude and the appointments that will follow. So really just a little history on voter suppression. This is not a recent theme. We've seen that in historical context since really before the passing of the 15th Amendment. And the 15th Amendment was one of the civil rights amendments, and that really gave us and leveraged the power exchange and opened the avenues, but that was met with gross hostility and outright opposition. So we've seen the Black Codes and then the Jim Crow era. And it was introduced about the Voting Rights Act. And when you talk about the Voting Rights Act and that protection, in recent years, in 2013, the Supreme Court actually really suffocated the energy and the power out of the Voting Rights Act with overturning the pre-clearance protocol. So there were several states and municipalities and countries that actually had to submit their changes, their election changes, to the Department of Justice. And that's in recent time has been overturned. And since then, we've seen really a slippery slope of increased voter and suppression laws. We've seen ID laws that really target certain demographics, specifically college students that we know vote a particular more progressive agenda. And then in Florida, we fought very intensely when we see and talk about the Amendment 4. And in recent news, they have really stripped that opportunity from those who are being convicted of felonies to even have the right to vote. The number prior to this was around roughly 774,000. And with the requirement that they had to repay their restitution, repay their fines, that number dropped down to 100,000. So now we can really begin to see that there's an attack on democracy. There's an attack on the progressive agenda. There's an attack on really us pushing America forward. And so as a young professional, it's really going to be our responsibility to step up to the challenge. And I think that's going to be through a few different strategies. One is procedural. The other one is substantive. Procedural is really knowing where to mail in ballots when you talk specifically about college students. When we talk about the 7 Million Strong initiative, that from 2016 to the current, there have been roughly 7 million young folks who are now eligible to vote. So really tapping into those and galvanizing and mobilizing them with the right information to really be informed voters. Understanding the Duval of Elections website, checking your profile. Last week I checked my profile and I ran into a problem. And I wouldn't have done that if I didn't have really an engagement earlier that caused me to say, okay, let me just check my voter registration information, see if it's updated. And I ran into an issue locally. But there is a state registration that you can follow. So understanding that you might have to also update your signature. That was also a voter suppression attempt. And so we're going to need those type of initiatives and be aware of those type of offenses. Being aware of those dates that President Rumling spoke on, voter registration deadlines early, the mail-in, and really mobilizing individuals doing those phases. There's going to be an increased wave of mail-in ballots, so we're going to need to be prepared for that. Have we canvassed our communities to ensure that we have the infrastructure to support increased mail-in ballots? Understanding what polling locations we have, and then also just the overall process. And then the substantive, the disinformation and misinformation that oftentimes comes with this type of election cycle. So making sure that we are interrogating, one, the media that's really getting pushed out, the dates, the communication, the narrative that's really being communicated to our community specifically. And making sure that when individuals come to us, that we are a reservoir of knowledge and accurate knowledge at that. We cannot run away, and I think especially in the young generation, what I consider conscious politics. And those are the ones that say, my vote doesn't count. We need to leave, the partisan party anyway, the partisan system anyway. And while that might have some merit, the time right now is too important, and we have more pressing concerns. So I think we have to, one, curtail those type of conversations, those type of philosophies at the moment, because we have a mission at hand and we need to make sure that we are unified in moving forward. And so I think right now, understanding that dynamic, understanding those different strategies that voter suppression has looked like and what it looks like in contemporary times is going to be important for us. And then getting involved with local, like the NAACP, the Jacksonville Urban League, ACLUs, maybe even law firms that do particular civic engagement work. Really being a unified front is what's going to be needed. And the young generation us, the young millennials, and we're going to be at the forefront of that. We bring that energy, but we also are going to need to tap into the wisdom of our elders. And then understanding that nothing happens and nothing has happened without policy and legislation. So we're going to need to get involved with civil rights on the policy front. And that's school board, city council meetings, and really pushing those things. So I'll leave you with what I say, above all, we must do what's necessary. Remember those dates. So thank you all, and I appreciate the opportunity to speak with you briefly.
Thank you, Dante. And I want to say, based on what I've heard, Jacksonville University is lucky to have you as an intern there in the Public Policy Institute. Give my best to Rick Mulaney.
I will.
And that brings us to Dwight James. Dwight, our civic engagement specialist from the
Good evening, everyone. This role is one new for me. So what I will say is that it's one showing me how important it is for all the citizens of Jacksonville to understand the necessity of voting by one turning to the numbers, right? In the primary election within Duval County, the demographics say that only 49,535 Black people voted. Now, I'm gonna repeat that number for you. 49,535 Black people voted within the presidential primaries. And the issue with that number is that there's way more Black people in Jacksonville. So that means that what aren't we doing to make sure that one, people in the city are getting registered to vote, and then two, what is it that we're doing to making sure that they're actually getting out to vote, and what resources can we give citizens that may not have the necessary transportation or even having internet to even being able to register to vote online. So a lot of things that we're doing is some online events between now and as well as election day to get people to go out and one, reclaim their vote, as the National Urban Leagues program is tasking me as well as the urban leagues around the nation to do. But then also to help people understand that individuals that do not vote, that do not exercise their right, and that do not exercise their civic responsibility are doing a disservice to the individuals that fought for that right. I believe that the work that we're doing here in Jacksonville is really going to show not only the people that haven't registered to vote, but the people that are hopefully going to vote to continue to be participating within the political world, because I believe that these numbers should not be how they are, because of just off the sole fact that Jacksonville has 1 million people, but they're all not counted for, and that's a problem. Why is it that within the 2016 election alone, the voter percent turnout for Black people was only 71.4%? And the thing is that this is for everyone that's counted for based on the numbers from the supervisor of elections. And so I really hope that the work that we're going to be doing in these next 39 to 40 days is really going to be mobilizing the community to make sure that they do their part. So just happy to be here and answer any questions that anyone may have and how they can get involved, as well as to be a part of the events that we're doing. And we also have a March to the Polls happening on the 30th at 3 p.m. We'll be marching from the courthouse downtown to the supervisor of elections office downtown to make sure that people can go out and vote, as well as get registered to vote, excuse me.
Thank you very much, Dwight, and thank you for organizing those kinds of efforts along with others within the league and some from our national group that's been helping with that. Thank you. And that brings us to Dr. Russ.
Great, thank you so much. Can you have the slides loaded, please? Thank you, Jocelyn. Again, thank you for this opportunity. It's definitely my pleasure to be before this body today. We'll be discussing the continued impact of COVID-19. Next slide, please. No financial disclosures, that's just habit informed. Next slide, please. All right, so again, some of this is going to seem redundant at this point, but I like to start back from where we were and the scope, and then we'll get to the impact today. So again, COVID-19 is actually the syndrome of coronavirus disease 2019 that comes from the severe acute respiratory syndrome coronavirus. It's very important that we think about these symptoms, especially as we get ready for cold and flu season. So fever, cough, shortness of breath, muscle aches, headaches, diarrhea, sore throat, vomiting, and loss of taste or smell. Just to put to frame the statistics, currently worldwide, we're at about a 3.1 case fatality ratio. That's a fancy way of saying that for every 100 people that get it, about 3 people will die from it. Recently in this country, we crossed the 200,000 threshold of deaths, and our case fatality ratio as a country is 2.9%, if you believe the data. Next slide, thank you. How has COVID-19 affected people of color? Well, going back to the early days, and I'm talking about even January, which now seems like a lifetime ago, bias was introduced in the beginning because we restricted access to testing to people that had been to Wuhan, China. That was literally one of the criteria for testing. It led to a false sense of security that this was a disease that would not affect people that look like us. We knew that people with comorbidities would have worse outcomes. That's due to the social determinants of health. Those are those things that you can't fix in an exam room, but that directly impact someone's health, whether it be access to fresh foods and vegetables, whether it be access to clean water, whether it be whether or not you have technology and can do a virtual visit with your doctor. The failure to expand Medicaid is a very big part of this, especially in the South. We have a sicker population at baseline compared to some of the other states that did expand Medicaid. And then lack of capacity, and this ties directly into the census. The number of hospitals we have, the number of residency spots we have for training physicians, all comes from the census and how many people the country has recorded. And then it's not as big of a threat now, and I say that with the caveat, we don't know how the next 2 months are going to go, but there was a risk of bias in terms of resource allocation when we were worried about if we were going to have enough ventilators for people. You can always kind of guess what will happen based on how people have behaved in the past. So if there's been bias in the healthcare system, and there's no doubt there has, you could have that as an area for concern. As we go into flu season, I do want to talk about how COVID is different than the flu. So first we have R0, which is just the basic reproduction number, and that represents for every person that has an illness, how many people are they likely to spread it to? Well, for the flu, it's 1.3. For COVID, it's 2 to 2.5. And again, we see cases now all across the country. There was a wedding in Maine where 7 people have now died due to exposure to COVID, and none of them were even at the wedding. Incubation time, this is what makes COVID particularly tricky. With the flu, you're going to, from the time you're exposed to the time you present with symptoms, it's going to be 1 to 4 days. With COVID, you're either going to remain asymptomatic, meaning having no symptoms, or have an incubation time from 1 to 14 days. So thinking about everybody that you interact with over a 2-week time period. Hospitalization rate, this has definitely changed. Historically for the flu, it's been 2%. Initially for COVID-19, it was 19%. It's kind of an bat your eyes and wink when we talk about that, because we know that there is limited data and some of the states are hiding information. And then again, we talked about the case fatality rate. 0.1% of people that are diagnosed with the flu will die. That number is as great as 3% with COVID. Next slide, please. So now we talk about the advocacy piece of COVID and why this is part of this presentation. Again, I think even though it feels like it's been with us forever at this point, we still have so much to learn about this disease. And we have so much to learn and analyze about how this disease will affect us as a country and as a world. So now we're going through the process of reopening schools, and we've gone from some kids are on a virtual homeroom. Some people have been going to class 5 days a week. We're bringing people into the schools now. So now you're having people mix that might have been in a protected environment for the past 6 months. I know everybody's trying to do everything they can to social distance, and you definitely want children to get the socialization aspect. I was talking with Dante recently. I have a kindergartner and he's at home and he needs the socialization. But when you do the risk-benefit analysis right now for us, it's too great a risk to send home. We need to look at the international cases that are happening right now. A lot of countries are starting to hit their second wave, and we're actually talking about countries that fully were on lockdown and had gotten the cases under control. How does this affect voting? I'm so glad that everybody's talking about the importance of this tonight. We need to vote. We need to vote numbers that we've never voted before, but we have to do it safely, whether that be participating in early voting or voting by mail. We have to make sure that our voices are heard, but we have to do it safely so that we're here to see the results in 2021. Flu season. Initially, the school of thought with COVID-19 was that if you had COVID, or if you had the flu or strep throat, you couldn't even get COVID. And now we know you can definitely have both infections. We don't know the impact of what both infections do to the body. We don't know what the numbers are like. I know flatten the curve, again, was our rally cry 6 months ago. We very well might end up there in a few short weeks. So again, this is not to take the advice of the relationship between you and your personal physician, but if you are eligible and a good candidate, please get your flu shot. Given the historic interaction between the healthcare system and vulnerable populations, we're now at a point where we have vaccine trials. People are scared to enter the trials, but we need people to enter the trials so we know how the vaccine affects people with different backgrounds. We don't know about the efficacy. I know the FDA recently came out saying that they are going to have the same stringent requirements they have so that we can at least feel that it's safe, but we don't know the efficacy or how effective it will be. And lastly, I think that anytime you have an opportunity to advocate, you have to. There are populations that, unless you're just thinking about it, you don't realize how hard they're being impacted by COVID. So that includes the homeless, whether they have the benefit of being in a shelter, but then again, you're in a place where you're at higher risk, or if they're currently on the street. The detained, there have been many, many recent cases about what's happening with the ICE detention center. So please advocate, contact your local legislators about them. We have detainees who are scared to report their symptoms because they've been placed in solitary confinement. Victims of abuse and sexual trafficking, I think we don't think about, one, the nature of the work that they're forced to do in terms of being in contact, and two, that even if they develop symptoms, who are they going to report them to? And lastly, the incarcerated, which again, Camille is going to definitely go more in depth with, but just please keep advocating for these vulnerable populations. Please protect yourselves as we get ready for cold flu season in the time of coronavirus. And again, thank you for the opportunity this evening.
Thank you, Dr. Russ. Really appreciate all the information and bringing us up to speed and making sure that we understand it's still a problem. And it's a problem for many, many people, particularly those vulnerable populations that we serve. So thank you. And that brings us to Camille Will-Thomas to talk about the impact of COVID-19 on our Florida prison systems.
Thank you, Mr. Stone. And once again, I just want to say how extremely honored I am to be on this panel. And extremely honored to be presenting this portion of the presentation. So, sorry, my voice is a little scratchy, but forgive me for that. But so with that, I'll jump into the last portion, which is geared towards informing you all about COVID-19 in our prison systems. So before I get started, I know it's a little dark, I'm not sure, but I'm just going to read off a few statistics. I got these from the Sentencing Project, and I'm going to read off a few that just came to mind and that just really stood out to me. The first one being that 1 in 3 Black men born in 2001 can expect to go to prison in their lifetime. I'll read off another one. I'm going to skip down a little bit so it goes a little faster. Florida has the 3rd largest prison population in the United States. Incarceration has increased by more than 500% in the last 40 years. Another one, nationally, Black males ages 30 to 34 have the highest custody and incarceration rate of any race, age, or gender. So after reading these statistics, I really wanted to emphasize a point, and you can turn to the next slide, Doctor. It's important to note that people who are incarcerated have higher rates of underlying medical conditions, putting them at greater risk of COVID, illness, or death. Infected inmates who complete their sentences are released from prison could pose a risk to the community. And that is not to say, to emphasize the risk that it brings to the community, but also to emphasize morality. what we mean when we say everyone counts. And this is exactly what we mean when we say that. Prisoner lives matter too. So, and on the slide, as you see, I'm sorry, the video box is like all of it. Okay, so I'm just gonna read this quote. It is important that when we talk about this particular issue, the coronavirus pandemic, that we understand that the correctional system's response is just as important as the community response. Everyone counts, and that just re-emphasizes what I've just stated. You can go to the next slide. And on the point of advocacy, I just wanted to inform everyone about a pending case. It's active right now, and you can Google it. It's brought by the Southern Poverty Law Center versus the Florida Department of Corrections. If you Google SPLC versus FDC, it'll come right up. And I just wanted to give, before I get into it, into the case, I just want to give everyone a breakdown of basically Florida. You see on there's a map of Florida, and all the red dots represent the current major institutions in Florida. So you can kind of see where you are relative to where all the dots are. I know the state of Florida is broken up into 4 regions. Currently where I sit in Jacksonville, we are currently in region 2 as far as prison populations. So I just wanted to show you guys that, that tidbit. Yeah, so you can turn to the next slide. Okay, so we all know that COVID-19 hit sort of abruptly, you know, and since its onset, there have been many measures put in place. I know I go to the store, there's hand sanitizer, there's masks, tons of signage alerting you 6 feet distancing. However, prisoners and the procedures that go in place in local prisons have not necessarily been put in place. And with that, there's some points of awareness that I wanted to raise. So this case, basically it's focused on the crowdedness of prisons and there not being a policy put in place to deal with COVID to combat that. So we already know that prisons are already overcrowded, and we already know the risk that prisoners are more prone to getting infections, diseases. They're already at a higher risk just simply from being overcrowded. So throwing COVID in the mix, it just makes things so much worse. So at the time the lawsuit was filed, hundreds, and I'm pretty sure as of now it's probably thousands of potentially incarcerated people in Florida prisons that had tested positive for COVID-19, and thousands more are probably exposed as of now. So, and on that second point, that populations at heightened risk are especially vulnerable. So the FDC's prisons incarcerated about 96,000 people. I'm pretty sure as of yesterday or today, it's probably a little bit more, including a substantial number of elderly people or those with compromised health. So of the 1.5 million adults currently in state and federal prisons, the age range of 55 and over, the demographic represents roughly 12% of that overall 1.5 million. So, and since 1999, there has been a 300% spike in the population of that age group of 55 and up. And by the year 2030, you can expect a substantial increase in the elderly population. So this is not just something that needs to be dealt with in the future, but it's rising right now. And this is an issue, especially with COVID and the elderly having pre-existing conditions and things of that nature. And on my last point, the lack of transparency, and this is the main thing that I wanted to tie into with advocacy, is that as far as the FDC's lack of not having a policy in place, it prevents the public from fully understanding what's going on, understanding the conditions inside Florida prisons during this pandemic. It hinders advocacy, and it is detrimental because lives are at stake. People are dying in our prisons. So this is why it is so important, and why I wanted to highlight this case to you all to demonstrate a current initiative by the Southern Poverty Law Center being brought against the FDC. So I just wanted to encourage everybody to follow this case if you can. Once again, you can Google it, SPLC versus Florida Department of Corrections. It'll come right up. I know I'll be following this case to see what happens next. And you can turn the slide. And with that, in closing, I just wanted to inform everybody of another topic. I know Dante Jennings mentioned it as well. As you all know or may not have known, earlier this month, it was ruled on that Florida felons must pay fines, restitution, legal fees before they can regain their right to vote. And as we all know, this could have broad implications on the November elections. So any effort to limit ballot access could play a detrimental role. So especially on disadvantaged populations and low-income families, this plays a big role in that. So just be on the lookout in the future for the Center for Advocacy and Social Justice's maybe future webinars or town halls will involve a discussion about this. So, and on that point, you can turn the slide. Just closing. Oh yeah, there it is. Sorry, you can turn. Go to the next slide. And my last point, I just wanted to encourage everyone to stay informed and stay involved in your local community, and just be on the lookout for Jacksonville Urban League Center for Advocacy and Social Justice, or just the Jacksonville Urban League in general, for a series of webinars, town halls that are geared toward launching criminal justice reform and informing the community about what is going on. Thank you.
Thank you so much, Camille. Couldn't think of a better person to finish up for us with our presentations. You really hit on some important points, and I'm pleased that our interns and our internal community at the Urban League and others outside are helping us with these presentations going forward. I'm excited because I know we're going to be getting information out that many people simply not only don't know about, but really nobody's tried to really get it to them. And I'm grateful that we're going to be able to do that. So with that, I'm going to open it up to questions. Anyone have any questions? You can chat it on the chat. And
yeah, before you get involved with the question, can I make one statement as it relates to the last person that just spoke, please?
Absolutely. And now that you mention that, I will, after you've spoken, I'm asking now if any of the other speakers would like to comment. Let's have them do that. So go ahead, President Rumlin.
I would just like to add that there are some dollars available. So anyone who knows anyone that need their fines and penalties paid, they need to contact us or the Perkins Bar Association, but they need to do it as soon as possible because we're on a time frame in order to get these fines paid in the courts and get these folks registered. So there are some dollars out there available to help these people pay their fines and fees.
Thank you very much. Very good point. Any other of the panelists, any comments?
Well, I'm not a panelist, but I tell you, I am so impressed with our presenters this evening. I just can't thank you enough for participating, and I believe we're on to something now. We can really work on our community engagement activities. So again, I just want to thank you guys. This has been great.
Can I make one statement?
Yes.
This is Justine Conley with AARP. How is everyone?
Good.
Incredible. AARP has a national initiative as well as local, protect the 50-plus voter, because we know the 50-plus turn out at a higher rate than anyone else to vote. And so, especially in Florida. And so that is our commitment, is to help to protect the 50-plus voter and help get the 50-plus voter out. So thank you for this presentation. It was phenomenal. And count us in.
And you guys have had some great commercials on Pandora.
That's what we do.
Thank you very much. I'll start.
Yeah, I wanted to just make one quick comment. I really appreciated Dr. Russ's points around being safe with voting, and the same concept applies with Census as well. So with all of the activities that I recommended at the beginning, please practice social distancing, wear a mask, leverage as much sort of like remote contact, but at the end of the day, it is true that kind of that like, shoe leather to pavement grassroots approach is some of the most effective, but you can do that in your own social circles, you know, where you are safe, and you can use that leveraging your own social media and just texting people that you know. So please do stay safe with that.
So I'll ask you a question while you're on the floor, and that is, of all the things you've seen in the census, what communities have demonstrated most effectively the ability to move the needle towards greater counting? What did they do?
So certainly, I think, well, actually, first, before I answer that, before I forget, I'm putting into the chat box all of the different ways that you can respond to the census still. Each of those links will take you to either the online portal that you can respond, and there's multiple languages available for that. The phone, which again, there's multiple languages available for that. And if you still have your paper form at home in the mail, there's directions on that. So that's all in the chat box right there. In terms of the most effective, so to be honest, you know, the smaller the community, the easier it has been for them to get a higher self-response rate, generally speaking. And part of the reason for that is because they are able to leverage the most effective sort of outreach tool, which is trusted messengers. Everybody in a small town kind of knows each other. So if you get one person or one community trusted leader telling, you know, the community why it's so important, they kind of all become like accountability buddies, right? Like, hey, we responded to the census, did you? You know, or the pastor's like, you know, how many people out there haven't responded yet? So I won't ask the question on this gathering, but if you have not responded to the census yet, please do. And then please also ask, like one of the other presenters said, you know, 5, 10 of your family, friends, coworkers, you know, if they have responded to the census. And if they haven't, and they have questions, I think the Jacksonville Urban League has a program going for how they can help inform you and answer any questions you have about responding to the census. If they just didn't know that they could do it because they didn't think they were eligible, literally everybody who is resident in America, whether it's in a house or not, whether they are a citizen or not, as long as they're not a tourist or a business traveler or something like that, they should be counted in the census, even if they, you know, were born on March 29th or March 30th. So, so small towns have been really effective at getting out the count in terms of like hitting just 100% self-response rates. That said, I think communities of color, particularly BIPOC communities, so Black, Indigenous, and other people of color, they have a lot of hurdles to overcome that are not just, there's like barriers because of a digital divide, right? There's internet access issues. But then there's also, frankly, particularly in the Black community, a high level of mistrust of government because the government has a long history of doing things that have led to that mistrust. And so there's a lot of census education that needs to be done within historically accounted communities of why do we even need to respond? Really interesting, one of our grantees in New York City, their primary group that they were trying to focus on were African immigrants, and to convince them and make sure that they understand they're supposed to respond to the census, why it's important, et cetera. They actually realized they had very little resistance from African immigrants. As soon as they knew that they were supposed to respond, they responded. There wasn't a lot of kind of convincing that had to happen. It was actually the African American folks in their community that they had to have many more conversations with and sort of do that convincing. So on a one-on-one like sort of approach, that's obviously very time consuming, but every census response counts. But that's where like leveraging those trusted partnerships and trusted messengers is really, really critical. So obviously Jacksonville Urban League is a trusted messenger in your community, but there might even be like even more localized, particularly in those low response areas that I highlighted on that map.
Thank you very much.
Yeah.
I'd like to shift gears a little bit and ask President Rumlin, you mentioned the 60s, comparing the 60 election with the current. What, if you could put your finger on it, what would it be? What do you see as the most significant difference? And is it the same or is it significantly different now but equally as important.
It's equally as important. But what happened, we was in the process of integration at that time. President Eisenhower had already sent federal troops to Little Rock, Arkansas to integrate Central High School. Leading that up to the election of 1960, we had all kind of demonstration with the civil rights movement. Dr. King marching, the Selma, Chicago was involved, Georgia, Florida, even St. Augustine. So leading up to 1964, and President Kennedy, to a certain degree, did not want to fully tackle the civil rights movement. And as a result of his assassination, Dr. King put so much pressure on President Johnson to sign the Civil Rights Act of 1965. And every 25 years since that time, they've had to go in and pass another, for lack of, I can't think of it right now, but every 25 years, the Voting Rights Act had to be renewed. Renewed. So what we're seeing now, I think, we're seeing protests all over this country. And a lot of it is coming from, you know, we don't want to say it, but most of it is coming from President Trump. And he's causing so much hatred. And we're seeing it from, white conservatives who are attempting to make America great again in a certain way, but at the same time, we see that that's not working, but they're doing everything that they can do in order to reverse a lot of gains that has been made over the last 50, 60 years. So if we're not careful over the next 4 years, if President Trump is reelected, we're going to continue to see reverse court cases at the Supreme Court level. I mean, they're even talking about, you know, Brown versus Board of Education. So that's the reason why this election is so important, in order to attempt to protect some of the gains that has been made over the last 50 years. If we don't, then I think you're going to see history repeat itself.
Thank you very much. And shifting gears again, Dr. Russ, in terms of COVID, I'm sure you mentioned it in your talk, but just take us to two things that you think we should all be doing to make sure that this doesn't continue, and what should we watch for in the future in terms of how it's going to impact our health, and what should we be doing in the future?
Great questions. So first and foremost, we all recognize now that we have COVID fatigue. It's really hard to social distance, to not go anywhere, not travel for 6, 8, 10 months. So not letting your guard down, realizing that even if you're in a small gathering in your home with close family, loved ones, if they've gone and been exposed to someone else, you still need to wear your mask. Knowing that we don't know everything about this disease yet, We know that if you're 5 and you get chicken pox, you may get shingles when you're 60. We don't know what happens with COVID in a year, 5 years, 10 years. So by all means, doing everything that you can to protect yourself, social distancing, wearing your mask, frequent hand washing or sanitizing, which they seem really basic, but after a while they become redundant and people start to decide that maybe they no longer want to do them, or some people have decided that the pandemic is over and they're going to go live their best lives. But so that we can all live our best lives and again, make it to 2021, taking those basic precautions. If you do have symptoms, not going out into crowds. If you're asymptomatic, but you know you've been exposed, regardless of what the guidelines say, go and get tested so that you know your status. We talk about the parallels between HIV and COVID. Know your status and protect yourself. That's all we can do until we have a vaccine or a cure. Thank you for the question.
All right, thank you. I see Camille paying close attention to what's going on. Any further thoughts? I know that typically when you give the kind of talk you did, particularly as a law student, after the fact you go, oh, I should have said this. Well, now's your chance. What did you miss?
Well, I feel as though the bucket of things to talk about is just expansive. I feel like there's so many things I could have spoken on, but if there was one, I would have definitely just emphasized the importance of communicating with the community as far as what's going on. I think I touched on it lightly, but just saying ways to how we can get involved, and especially with criminal justice reform. And one of the things that we are currently working on at the Center for Advocacy and Social Justice is reaching out to local organizations that focus on reentry. And that's one of the ways that you can literally Google Jacksonville reentry programs and something will pop up. So definitely reaching out just to have an example for a way for the community to reach out. You can literally Google Jacksonville reentry programs, and they often have tons of volunteer opportunities and tons of ways to get involved. I know I personally have family members who've been to prison and who are out now and aren't necessarily certain of what to do, what are the resources available to them. So, and I think in the long run, as far as criminal justice reform, recidivism, getting a job, having somewhere where to live, you know, it plays a big part. Having a job, those things at your fingertips, it plays a big part. So I think that's one thing I would love to stress. And one of the initiatives that anybody could simply Google and be a part of. And follow Jacksonville Urban League and the Center for Advocacy and Social Justice. And there's tons of ways to get involved. So that's all I got.
That's fantastic. Thank you very much. I really appreciate that. It's unfortunate that the topic is so sobering, but it's great to hear your input. Dwight, from a civic engagement perspective, I know you're brand new at the position at the Urban League. You've taken us on a march. You've been engaged with the young professionals. In your first few weeks, what have you noticed that's gotten you thinking in a particular direction? Comments?
Well, what I'll say is that in terms of engaging people, it looks very different than what it used to be, especially back in 2016. And so in terms of getting people out, I know that folks that are a little bit older don't feel safe with going out and being at the events and whatnot, but I know the younger crowd is being a bit more, how can I say this? They're being a bit more risky. And so I've been really trying to figure out how can I find this balance of making sure that people are getting the information that they need, and then also bring them out so that they can get registered to vote and whatnot, maybe even having more incentives for bringing people out and whatnot, but then doing it, you know, throughout the day. So then that way it's not just confined to one moment within the day. And then it gives people a lot more time where, you know, if it's busy during one part of the day, then gives them time to come later on and whatnot. So I've been playing a lot with timing and just making sure that I can allot times for the events that we're going to be having, to make sure that we have people come out and whatnot, as well as reaching out to different organizations within colleges, as well as just within the general public that are involved in their community and whatnot, and then, you know, inviting them to our events so that way it can reach their base as well, and not just solely depending on traditional methods. So really going outside of the box to make things happen has been, I'll say, one of the challenges that's been more exciting than an actual difficult task to do so, because it's allowed me to meet a lot of different individuals across Jacksonville, even as well as outside Jacksonville as well.
Thank you. Sounds like you're the right person for the position, and anything we can do to help support that, we appreciate your being with us. Mr. Jennings, are you still with us?
Oh, Dante is not with us.
He's had to leave?
Dante had to go to class. He's at JU.
Oh, that's
today.
right. Yes. Yes. Back at the Institute of Public Policy. That's great. Okay. Let's see. Actually, President Danford, any comments on what you've heard that you'd like to share with us? You're on mute.
Yeah, I've got quite a bit going on, but we've had some very good information tonight. The challenge, obviously, how do we get people engaged to the point where they feel a need to exercise a right that has been presented, where people, it costs many people their lives for us to have this opportunity. I think it's un-American for people not to exercise their rights. And knowing how difficult it has been for us as African Americans and as coloreds and as Negroes and as Blacks, we just do a disservice to ourselves and our families if we don't step up and take responsibility. We need more people in our community taking responsibility for their own lives. We can help, but as we think about murders in our city, if we think about the inability of this community to come together, whether it's with our police, whether it's with our state attorney, all of these entities, the community, the city council, we've offered up opportunities to engage the community such that they would have input into determining the resources, the distribution of resources. We see the 50-year drought in certain parts of our community. It's tough, but I want our young people to not give up before they give out. I mean, this is a long haul, it's a long fight. And so we want to encourage young people to become more involved, more responsible, and we will do what we can at the Urban League to assist in that. So thank all of you so very much for participating, and we look forward to other events similar to this one. Thank you very much.
Thank you, President Danford. I do see Erica Henry on the gallery. I don't know if you're available, but it'd be great if you could give us just a couple of comments on what you're doing, working with us from the National Urban League and helping with getting out the vote.
Hello, everyone. I am really happy to be here with you all, and the information that was shared was very useful. I'm actually from the National Urban League here in Jacksonville, and right now we are planning a couple of events to engage the community, more so the younger demographic. We will be posting the events. Sorry, I'm out somewhere. We'll be posting the events on Facebook. We're just trying to solidify some of the events that we will be having between now and November 3rd, Election Day. This is going to be more of a hashtag, virtual. We'll be out there at the polls, taking videos of the younger generation, putting in their votes in and their experiences so where we can be live on Facebook and sharing the experience with the community of Jacksonville. So I'm really happy to be here. I'm really happy to actually be able to, you know, put some kind of happiness in our younger generation, to have them motivated to actually go out to vote for the community.
Well, thank you very much, Erica.
You a doctor?
Well, thank you very much. And any other questions for our panelists?
I do have one question.
Oh, okay, go ahead.
I know that we were speaking about the returning citizens. Does anyone know if there is a database where they're providing those that actually have been released in the past 5 years, so we can see if they're registered, or this is something we're just pretty much going around the community and asking if they were registered or if they need any help?
There is significant data being gathered by the individuals who got the amendment passed in the first place. And then there are a couple of other organizations that are collecting data on this. Anyone else have anything more specific to respond to that question? If not, we can get you that information, Erica.
Thank you very much.
All right. Any other questions for our panelists?
Dennis?
Yes.
Dennis. Yes, I see a few of my colleagues from around the country. Ms. Brenda McDuffie could you say hello to us? Brenda, are you available to make a few remarks? Okay, maybe not.
All right.
I know Justin from Houston was on earlier, so that's it. That's all for me, Dennis.
All right. Well, thank you everyone for joining us this evening. And I want to thank our speakers who took the time to be with us and prepare and provide some really important information. It seems to me that the theme we're walking away from is we're all leaders, and leaders count, and leaders need to get out and let people know they need to be counted and need to step up and ask for help if they need it, so that they can be counted in the census, in the vote, and just going forward in these troubling times that we have to be heard. So with that, we will adjourn and look forward to our next meeting in the next couple of weeks. And we'll be, as Dr. Danford said, we will be having a series of these covering a number of topics that are important as these were for us tonight. So thank you, everyone. And thank you all of you at the Urban League and our external partners as well for making this happen. So thank you.
This is Brenda McDuffie from the Buffalo Urban League affiliate. And I just want to say thank you, thank you, thank you. We had several people from Buffalo join us tonight, and I asked and put it out to our team because we have to make sure every person is counted, especially from our communities. This is really, when we talk about our future, our entire future as Americans is at stake. So thank you for this opportunity to gather and share information and reinforce the work that we absolutely must do together.
Thank you. I can't think of a better way to close. Appreciate it. All right. Well, thank you, everyone. Good night.
Please stay safe and well, everyone.
Thanks, everyone. Have a good one.